Hello, Mr. Garcia. My name is Maria. I'm one of the healthcare assistants here at Oakwood Practice. Is it all right if I sit down and have a chat with you for about 20 to 30 minutes? How does that sound?
Yeah, that's fine, mate.
Thank you. Before we start, can I just check what you'd like me to call you? Is Mr. Garcia okay, or would you prefer John?
John is fine, thank you.
Lovely. Thank you, John. I know you've recently had some news about your health and it can feel a bit overwhelming. This time is for you, so we can talk through how you're getting on and what matters most to you right now.
Yeah, that helps, thanks.
Just so you know, I'll be making a few notes while we talk so I don't forget anything important, but I'm still listening to you. Is that okay?
Sure.
Could you tell me, in your own words, what you understand about the recent diagnosis and what's been happening with your health?
Well, they said my blood sugar was high and I've got type 2 diabetes. I don't really know what that means, I just know it's bad.
It sounds like you've been told you have type 2 diabetes, and that feels worrying, especially when you're not sure exactly what it means yet.
Yes, exactly.
That's completely understandable, John. A lot of people feel anxious when they first hear that. What's the biggest concern on your mind about it at the moment?
I'm scared it's going to stop me working. I drive for a living. And I don't want to end up losing my leg or something.
Your work is really important to you, and you've heard stories about serious complications like amputations. Those are frightening thoughts. The good news is that with the right support, many people manage diabetes and live the life they want.
Okay.
What would you most like to get out of today's conversation?
Food and how this is going to affect work, really.
So food and fitting this around your job are top priorities. I'd also like to ask a few questions about your general health and day-to-day routine so we can understand the whole picture.
Yeah, that sounds good.
Can you walk me through a typical day for you, from when you wake up to when you go to bed? I'm especially interested in things like meals, drinks, physical activity, and how you're feeling during the day.
I don't really stop for lunch. I just grab whatever's easy, crisps, sandwiches.
I see.
By the time I get home, I'm shattered, so we order takeaway a lot. I don't really exercise, just too tired.
So you're up very early, long hours on the road, grabbing food where you can, and by the evening you're exhausted, so takeaways feel like the only realistic option. That sounds like a very demanding routine. With everything you're juggling, it makes sense that changing things feels hard. Even so, you've come in today and you're talking about it, which shows you care about your health. On a scale from 0 to 10, where 0 is not at all ready and 10 is really ready to make some changes, where do you think you are at the moment?
Maybe a 5?
A 5 is interesting. Why a 5 and not a 2 or 3?
Well, I've got 2 kids. I want to be around for them. And I don't want to get worse.
So your children and staying well for them are a big motivation. That's really important to you. Would it be okay if I check what you've already been told about how diabetes and weight can affect your health and fill in any gaps?
Sure, I don't think I know much.
Very briefly, type 2 diabetes means your body finds it harder to use insulin properly, so sugar builds up in your blood. Over time, if blood sugars stay high, it can affect things like your eyes, kidneys, nerves, and circulation. The positive side is that things like food choices, being a bit more active, taking tablets if they're prescribed, and coming to regular reviews can really reduce that risk. As I explain things, please stop me if I'm not making sense. Does that explanation fit with what you've heard so far?
Yeah, that's clearer, actually.
Great. What questions do you have at this point? Anything you're particularly unsure about?
I just don't know what I'm allowed to eat now.
Food is a big topic, and we don't have to sort everything today, but we can start with small, realistic ideas that might work for you on the road. Thinking about what you usually eat on a work day, what's one meal or snack you feel might be easiest to change first? Okay, breakfast. At the moment, you often have coffee and a pastry from the garage. What could be a slightly healthier option that still feels realistic when you're rushing at 5 a.m.?
Maybe some yogurt and fruit.
That's a good idea. Some people find keeping yogurt and fruit at home or even in the van helps.
Right, that's helpful.
What do you think you could do on, say, 2 mornings a week to start with?
I could do yogurt and a banana at home, maybe. 2 days doesn't sound too bad.
So you're thinking on 2 mornings a week, you'd have yogurt and a banana at home instead of grabbing a pastry on the way.
Yes, exactly. I think that would work.
How confident do you feel from 0 to 10 that you could do that next week?
About a 7.
Okay, that's good. A 7 is great. What would make it an 8?
Probably just making sure I've actually bought them.
Okay, that's perfect. So part of the plan is making sure they're on your shopping list. I'll note that down so the rest of the team can see what you're aiming for. You've had a lot to take in. How has all of this been affecting your mood or stress levels?
I've been a bit down, to be honest. I keep thinking I've messed up.
I'm really sorry to hear you've been feeling down. Many people blame themselves when they get this diagnosis, but it's usually a mix of things like genetics, lifestyle, and life circumstances. It doesn't mean you failed. What do you usually do, or who do you usually talk to when you're feeling low?
My wife, sometimes. I don't really talk to anyone else about it, though.
It's good that you can talk to your wife. If you'd find it helpful, we also have things like group education sessions for people with diabetes. And some people benefit from talking to a nurse or counsellor about the emotional side. How would you feel about me passing your name to our diabetes nurse so they can go through options with you?
Yeah, I think that would be helpful.